Welcome to the Daily Dose with Dr. Cristin. I'm Dr. Cristin Fitzpatrick, International Healthcare Professional of the Year and Director of the Mediterranean Brain and Spine Center, home to Malta's award-winning international team of specialists. Here's the Daily Dose. We're focused on what truly matters, helping you and your family stay healthy, balanced, and thriving every day.
Dr. Cristin, today I want to discuss fibromyalgia. Unfortunately, the reports are on the rise, the cases are on the rise. Let's start from scratch. What is fibromyalgia?
Okay, so fibromyalgia is a really interesting diagnosis because it is something that patients receive when they have chronic pain for a certain period of time, and healthcare providers are unable to pinpoint the source of pain. When I see it traditionally, when we look at fibromyalgia, it is very brain-based, but there's many causes that create a certain inflammatory process that creates the firing of that pain signal. So patients feel that. Essentially, sometimes people will say, oh, it's psychological, oh, it's metabolic in nature, it's neurological in nature. In most cases, it's a combination of several different things happening at the same time.
Is it related to stress?
Stress is definitely a part of it because with stress we produce cortisol, and when cortisol's in production, it affects even our insulin resistance. So we look metabolically at the whole process and what's happening. It's not a direct cause and effect because there's many people with stress that do not have fibromyalgia. Typically when we look at these things, there are so many different factors when it comes to health, and one thing that we emphasize in the clinic is we have to look at a patient holistically. So holistically, we say the whole body, what is happening in the body, what are the lifestyle factors, what's the health history, a case review. Those types of consultations are really important to really get a grasp on what's happening in a patient's life.
How is fibromyalgia diagnosed? Because I have this impression that they have a very long list. And if you tick all those symptoms, then it's fibromyalgia. How is it diagnosed?
I think different regions, different countries have different ways on how they diagnose it. Traditionally, what we would do is we would actually do a test on different areas of the body, and if they check over a certain amount of pain points, then it categorizes as fibromyalgia. Now, there are factors that go into it, like any diagnosis, but obviously there's a lot of patients that will fit the check mark of many different diagnoses. However, they do not have that condition. So in those cases, we use it to objectify. So it's something for us on paper. We can say, okay, they've reached 17 of 24 points, and this is a positive finding to signify that diagnosis. And then through a treatment plan that we do, so really looking at the nervous system, making sure we're giving the nerves what they need, looking at the metabolic process, looking at those specific points that are maybe provoking the pain response in the first place. Also looking at pathways inside the brain, because certain thoughts, certain areas and matrices in the brain are involved in chronic and persistent pain. So chronic and persistent pain, I did a whole series in managing chronic and persistent pain. And I know this sounds really weird when I say this, but I love pain. I love when patients have it, and I love when we get rid of it. So these types of things, pain is always a symptom. It's a signal that something is happening. And when we're specific about what we do in our projections for what we expect for patients, and we tackle these things one layer at a time, we'll see that we can eliminate the feeling of pain.
A lot of fibromyalgia patients have the impression that it's for life. It's chronic and you're gonna have pain for all your life. That isn't so, right? We have remedies that can help.
Yeah, there's many different factors involved in this. I've had dozens of fibromyalgia patients this past year, and they all say the same thing. They go, I can't believe I'm starting this year feeling so good. They're regaining their lives. They're getting involved in different activities that they enjoy doing, which obviously that improves our quality of life. It is not something that you have to have forever. However, if we don't do something about it, if we don't respond to those signals that we have, unfortunately, it may be something that, people have forever. And, in a lot of cases, I say with patients, come on in, let's do a consultation first. Let's see what's going on. And once we see what's going on and we can explain to them what we're finding, what we're seeing, and what's happening, it makes sense to them. So that I'm going to have it forever, all of the sudden starts to fade away. And when that starts to fade away, then they know that there's hope in correcting the problem. So it is not something that they have to have forever. They just need someone to coach them along and the action steps they need to take to be able to calm down that pain signal.
So the common denominator of almost every condition, every disease, sickness, call it whatever you like, is a lifestyle change. It has to be holistic, right?
Yeah, and this is something that we talk about. So the difference and what we really try to communicate with the patient is we're about health care. We're not about sick care. We have those different places we can go when something is happening that's more acute, more traumatic, and those types of things. We're all about promoting healthcare, and it's not just saying, well, do this, 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 and this, and this. We all know that those are healthy things to do, but it's about finding a formula that really works for patients in their everyday life. And yes, we will create a lifestyle to promote the body not going into a state of sickness or illness. It's more preventative care and knowing how to actually use these amazing bodies that we're gifted. So yeah, there's many factors involved in it. When it comes to that, we're sort of the gray area. When it comes to healthcare, we understand the medical terms, we understand what is happening, whether it's something kind of simple or much more complex. It's sort of having that middle area and being able to have an action plan with our patients about how to achieve their health goals that they're looking for.
Amazing. Thank you so much.
Super. Thank you so much.